But what we're going to be talking about tonight is respiratory. And this is a big thing with respiratory. So with respiratory, you've got, starting at the top, you've got sinus problems and then sore throats. In fact, I get many mothers saying, what can I do for strep throat? Strep throat. You know what I say? How do you know it's strep throat? You know, we always called it sore throat. Now it's called strep throat, apparently. It's still a sore throat. And then coming down, it could be even just a simple cold, but coming down to bronchitis, tonsillitis, even asthma, pneumonia. These are all problems that are happening in the respiratory. And so where's my why? And there is always a reason. Why do these problems happen? Well, let me begin with the common cold. So in the 1940s in Salisbury, London, the Common Cold Research Unit was set up to find the cause and the cure of the common cold. They would get people, they'd put them in hot baths, then take them out and put them in the cold air. But they didn't get a cold. And then they'd get the people and they'd put them in a hot bath and they'd scrape the throat of someone that had a cold and put that in the person in the hot bath and then put them out in the cold air, and they didn't get a cold. In fact, after 40 years, they closed down in disgrace, really, because of a total inability to find the cause and the cure of the common cold. And they never will, because a cold is a house clean. It's just a house clean. And a friend of mine, his name's Gary Martin, he was the health director at Living Valley Springs Retreat in Australia for many years. He said that he found with a lot of cancer patients there were two common denominators. One, they never get colds. And two, they don't drink water. Now, when you're cleaning your car, what do you use? Water. When you're cleaning your dishes, water. The body, water. So because they weren't getting a regular house clean with daily water, and because they weren't getting regular colds, waste was building up in the body. And the waste build up in the body was a contributing factor to laying the groundwork of cancer. Interesting. So when you have a cold, you know, you're blowing your nose, coughing up, what's all that? It's waste. It's the body getting rid of waste. I mentioned earlier in the week our lymphatic system. And our lymphatic system sweeps away waste from the tissues and it throws the waste into our respiratory. So the largest lymphatic organ is the tonsils, remember that? So I've been struggling with a little bit of a sore throat, so I've been having a lot of garlic and a lot of cayenne pepper, and I must do the running up and down the hills in the morning. Well, that hill near the gorge, you don't have to run. You just walk fast and you get high intensity. Oh, I was so excited this morning. I coughed up 4 lumps. Where's that coming from? It's from my tonsils. I know it's from my tonsils because I'm not coughing here. It's just coming from my throat. And so when I go home, I do oil pulling, which is coconut oil in the mouth, swishing around 10 times and then release it out, either in you call it a trash can, or you don't call it plug hole. Don't put it down the plug hole, the sink, you call it sinkhole, because coconut oil, when it goes hard, what happens? Solid. Don't put it down the drain or you'll be in trouble. And often after that, there's a cough up, because what it's doing, the name's called oil pulling. It's coconut oil in the mouth and you swish and you're pulling waste from in the lungs, you're pulling waste from the tonsils, you're pulling waste from the sinuses, you're also pulling waste from the tongue, you're pulling waste from the glands under the tongue. Waste is being pulled from the blood vessels under the tongue. That's why it's called oil pulling. And Bruce Fife, F-I-F-E, he's written a whole book on it. One wonders how he could write a whole book on oil pulling, but he has. And he shows that just this simple thing, I've only known about it for about 10 years, but apparently it's been quite common all through Asia, is oil pulling as a way, a simple little way of just pulling waste out of these areas. So if you have a cold, if you have a sinus, if you have any chest, a part of what you do to the body to bring about healing can be oil pulling. Now, because I travel a lot and sometimes I'm not breathing in the breast air, especially when I'm on planes a lot, I regularly oil pull. And I'm amazed when I oil pull that I'll often cough up a lump. And you know what I think? If I didn't oil pull, where would that lump stay? And if I didn't go up the big hills and down in the morning and I didn't cough up that lump, where would it stay? Well, I'd have to get more of a cold, because that's what a cold is. It's a house clean. And if you give the body the right conditions when the house clean comes, it can actually go through your body very quickly, maybe in a couple of days, and you'll be right. But one of the reasons why people get excess mucus in the respiratory areas is because of an allergy. And that allergy could be to exposure to chemicals, it could be exposure to mold. Check your house. There can't be any mold in your house. It's a toxin. And it can also be an allergy to food. So it's a matter of putting the detective hat on and finding out, now, why do I have all this mucus? Now, if someone's got a cold, they're going to have mucus. And if someone had a cold and it went to the chest, they probably cough for 3 weeks. That's usual. One lady said, my little one's been coughing for 2 weeks. I'll say, yeah, that's usual. That's usual. So let the body do its house clean. And rejoice every time a lump comes up. Where was it before it came up? It was in you. That's right. And so be cautious of exposure, especially if children are regularly getting tonsillitis, regularly getting colds. You've got to put the detective hat on. Maybe a cold or 2 a year. Children get a lot more colds than adults because that is boosting their immune system. And one of the best things you can get when you've got a cold is a fever. What did I call it? Best. When I trained as a nurse, fever was our enemy. But when you understand the human body and how it works, and look what a fever does, you begin to realize fever is actually your friend. And fever has a purpose. So rather than when something happens to the body looking for a drug, oh no, we don't do that anymore, a herb, something to stop it, look at why is it there? And how can we work with it to bring about healing? It's like one young man from Romania, he often dialogues with me, and his little one had a fever, so rushed straight to emergency. You know what I think? Why would you do that? All my children had fevers, but I never did, because I thought, well, why is it there? And then it's usually because maybe they're teething, maybe they've got a cold. It has a purpose. So this young man was told to take a tablet to stop the fever. I don't know, do you have Panadol or Tylenol, something like that? Oh, and the fever goes away. 4 hours later, once the drug's worn off, what happens? Fever comes back. So when you take the drug again, fever goes down. It doesn't make any sense to me. What you've got to look at is, why is it there? That it has a purpose. And when it's finished its purpose, guess what? The fever will go down. And so he contacted me and said, it's just driving me crazy. I can't sleep at night. I don't want to give my child this drug, and yet every time the drug wears off, the fever comes back. And I have to be, of course, gracious, but you almost feel like saying, are you getting the message? That's why it's so important to do this. Listen, what's the body saying to you? Now, my husband, he loves burning off. Whenever rubbish builds up, burns it off. It's always burning off. And sometimes what happens to the fire? Yeah, it gets away. I know when I come home the fire got away because there's black all over the place. And what does he do to put the fire out? What's the best thing to put the fire out? Water. Same with a fever. So think of my husband with his hose, and you don't have to put the hose over someone, and you can be a little bit more gracious, and they can go into the shower or they can go into a tub of water. Not a hot shower, not a cold shower, but a lukewarm. Now, if you don't have a fever and you go in a lukewarm bath, it'll be like the same temperature. But if you have a fever and go into a lukewarm bath, it'll be a little cool. But you won't get that shock. So remember, fever has your friend. It has a purpose. So what's its purpose? To boost your immune system. So rising the temperature in the body stimulates the bone marrow to make more red and white blood cells. There's your immune system. But also, high fever can burn out any harmful pathogens in the body. And when a person has a fever, it increases their metabolic rate. That means it increases the blood movement through the body, the lymphatic movement through the body, so it boosts healing. That's what a fever does. And at Misty Mountain Health Retreat, we create fevers every afternoon in the steam sauna. We put the people in the steam sauna. Well, they choose to go in. It's like a little wooden hut, and they sit in and they get very, very hot. Then they run out and dive into the creek and then back into the steam sauna, and they do that 3 times. We're creating a fever. And the reason the cold is there is because our brain does not like to get hot. That's the only part of the body that does not like to get hot. I've never heard of people putting hot compresses on the brain, have you? No, if someone has a fever or a headache, what sort of compresses do you put there? Cold, because that's, nice. See, listen, watch and observe. The only time I have found a child will convulse with a fever, and I think that's why many people rush to emergency with a little one with a fever, because they fear a convulsion. Now, I've read up much on this because it interests me greatly, because I want to dissipate the fear. And no child has ever sustained brain damage from a convulsion from a fever. It's good to know that. And the only time a child will really convulse with a fever if the child is dehydrated. And so water puts the fire out. Water, fire out. So water meaning in and out. So water on the outside could be a cold shower, it could be sponging the body with lukewarm water, it could be shower, bath, cold on the head. And what happens if you put a hot body into a tepid or lukewarm bath, when they get out, the water will be hotter than when they went in. Where's the heat come from? It's been pulled out of the body, because the best conductor of hot and cold is water. And often when someone has a fever and they're getting uncomfortable, it's because the body can't get rid of the heat quick enough. And water will pull that heat out. And water on the inside. So suck on ice, ice blocks, anything to get the fluid in. So if I had a baby that had a fever, I would just feed them all the time. Every half hour if they wanted to go on, because I wanted to maintain their hydration, their fluid levels inside the body, and then I knew that there was no danger of the child convulsing. What if a child won't drink water? What if they won't even drink anything and they're getting very hot? Even just laying them in a bath, if they're getting dehydrated, the skin will absorb the water from the bath. And another is to give them an enema, just a warm water enema. That's the quickest way to hydrate the body. A person maybe feel vomiting or sick and they can't drink much water. You can put 2 cups of water into the colon and it'll take it up like that. Now that's quicker than a drip in the arm. And if my child had a fever and was vomiting and couldn't drink, I have to tell you, I'd much rather give an enema at home than to rush to hospital, have to wait in casualty and wait behind the people having heart attacks and they've just lost a foot, etc., because that's what happens in emergency. The serious cases get seen first. And so a child with a fever can often go down the list. Wouldn't you rather be home? And just give the enema to the child, and then the hydration comes up. And also remember the when all the waste is burnt up, the fire goes out. Proverbs 14 verse 6 says, knowledge is easy to him that understands. When you understand what a fever is, when you know how to treat it, there is nothing to fear. There's nothing to fear. And it'll zoom up healing. So this young man who was saying, I can't sleep. Every time I give a drug, fever goes down and the fever comes back. And I told him what I did. I said, just keep the child well hydrated. Even just let them suck on a cloth, ice, anything, but get that water in. And put the little one in a teapot bath. She's hot again in an hour, put her back in the bath. She's hot in half an hour, put her back in the bath, put her back in the bath. And what you're doing, you're not totally eliminating the fever, you're just bringing it to a comfort spot, to the child's comfort. The next day he emailed me and he said, the fever's gone. I said, you let it take its course. But can you see how you can prolong the misery of a fever for days if you keep stopping it, because it's going to come back. Let it take its course. And all through Europe, for centuries, fever has been used as a therapy to help fight many diseases. But let's go back now to look at why there might be irritation in the respiratory organs. It might be exposure to chemicals, it might be exposure to mold, or it might be exposure to certain foods. And so the 5 main allergen foods are dairy, and that's one of the first symptoms of an intolerance to dairy is excess mucus in the respiratory organs. Also, the hybridized wheat, we've discussed that a couple of times. The hybridization of the wheat in the 1950s produced structures in that wheat that are not known in nature. And some people with a cast iron stomach who don't eat it, all day, every day, they don't appear to be many symptoms. But one of the symptoms of an allergy to wheat is excess mucus. Oats is high in a plant chemical called lectins. I think you call it oatmeal. We call it oats in Australia. And lectins, if they get into the blood, they increase inflammation. So if someone has an allergy of any type, they're best eliminating the oats. Once the allergen's been, or the allergy symptoms have gone and everything's settled back to normal, maybe they can have a little bit. You'll quickly see. If they have the oats and then the mucus appears, what's the body saying? No, go to millet, go to rice, go to something else. Peanuts are commonly contaminated with mold. And so they're best kept away if there's an allergy. And refined sugar, basically it just is like kerosene on a fire with any sickness. So when I was at Misty Mountain a few years ago, we had a nurse who was an ear, nose and throat specialist nurse. So what she does, she assists the surgeons and the doctors that are treating sinus. So they do a lot of sinus operations to clear out the sinus. She said, you wouldn't believe the green slime that we pull out of sinuses. And she said, and every specialist acknowledge is that it's fungus. So then my question is, well, why is it there? And then I was reading, and I think I've quoted this in my book, that in the 1990s, a group of doctors in the Mayo Clinic declared through their research that sinus was fungus. So why is it there? That's what I want to know. Why is it there? Well, when you get someone that's got an allergy to these foods and there's common excess mucus building up in that area, then the microorganisms evolve into or change roles into a cleanup or cleanup team, you could call it. That's called yeast and fungus. That's what they do. They clean up the area. But because the allergens continue and the mucus continues, then the fungus, the yeast, have a continual food supply there. And so they go and get all of it cleaned out. And by the way, because they're having to breathe through their mouth, then the little canals at the back of their nose are getting smaller and smaller. And so then the next option is to have it drilled out. Ugh. Yes, it's true. It does happen. And sometimes it's blocked up so much it bends, and it's called a deviated septum. Let me tell you about an experiment. Poor old monkeys. They've had a lot of experiment on them, but one doctor, he blocked up monkeys' noses for 6 months. And a group of monkeys, noses blocked up for 6 months. Their whole facial structure changed. Their jaws dropped down, and they were miserable looking creatures. After 6 months, they unblocked the nose and taped the mouth up. I think they unblocked the mouth when they drank and ate, but most of the time, the whole structure changed again. But what they found with the blocking of the noses, so they weren't being used, the little canals at the back of the nose shrunk right up, and even skin grew across those little canals. So when they taped the mouth, so they had to breathe through their nose, it only took a couple of weeks and those little canals were open wide again. An illustration, if you don't use it, you lose it. And I have been stressing nose breathing this week, but the question then arises, well, why do people mouth breathe? People mouth breathe because their sinuses are blocked up. What's the next question? Why are they blocked up? Usually because of an allergy, because mucus is produced to protect those delicate linings of the nasal passages back of the throat. It's a protection. So what's it being protected against? Protected against allergens. So again, it could be mold in the air, it could be chemicals in the air, or it could be foods, and the foods are a common one. Once those foods are stopped, it can take at least 2 months to see a response. So you can have a slice of bread, it'll be out of your body in 24 hours, I hope. But the effects can remain for sometimes up to 2 months. Some people stop for a month and see no effect, so they go back on them, but you've got to give it 2 months. And we've got so many options today. We've got almond milk, organic soy milk, coconut milk. People say, what milk do you drink, Barbara? I say, I don't drink any. I'm weaned. I eat food. Milk's for babies. But I do understand some people like to have a cereal or a hot drink with a bit of milk. And the simple needs bread or sourdough spelt bread. You've got Sprouts, Whole Foods. They've got quite a few bread options there. Oats for breakfast, you can have brown rice, that's nice in a slow cooker overnight, or millet in a slow cooker overnight. I've got grandchildren coming to stay in a couple of weeks, and I cook millet every morning. They love millet porridge, but you've got to put about 4 cups of water to 1 cup of millet to make it soft, otherwise it's dry. And they love it with some soy milk, a sliced banana, honey. Just love it. Goes a bit hard when it goes whole, but one of my grandsons, after lunch, he says, is there any millet? And they just eat it cold with milk and honey. That's like a dessert to them. It's not quite mine. They like it. And peanuts, there's so many nuts. Peanuts are a legume. They're grown in the ground. If there's a grower around here somewhere who's grown the peanuts, harvested them, and you can buy them, those peanuts would be good. The problem is most peanuts are stored, and today is a typical day. of what would cause the mold growth. Very cold, frosty morning. It was cold. In fact, Sylvia reckoned the water was even colder this morning. So it was a cold, frosty morning. And look at it now. Whew. If you're out there in the sun, I think you'd be taking your jumper off. So in a silo, what's happening? Moisture. Moisture is being built up, and that, of course, is conducive for mold growth. And there's so many options to the refined sugar. Honey, maple syrup, and palm sugars, they're all unrefined. So there's many options or alternatives to those allergies today. We've seen sinus clear up. We have seen tonsils shrink back down. We've seen respiratory problems clear up because of that. Is it safe to use nutritional yeast? I don't use it. I don't use it at all. You can't kill yeast. And there are so many people that I meet today who major or minor have some sort of yeast problem happening. Typical is the nails. They should look like that, look like a nail. One man was so excited about the change in his nails after changing his lifestyle, changing his diet, he sent me a photograph of his big toenail. And it was coming through perfectly clear, and the top was all lumpy and gnarly still. He was just so excited about his toenails. So nutritional yeast is not something that I use to make food taste magnificent. I use fresh herbs. So when I go to Holland, the people I stay with there, I always do the cooking. And in 1 week, I use up the herb supply that they use for a whole year. You got to put a lot of herbs in, and that makes it taste magnificent, and good quality salts and good quality oils. That's what makes food taste nice. You got to do something. And I think a lot of people that have come off eating and going over to vegetarianism, looking at the legumes, I mean, you cook a steak, you cook a chicken, it's just flavoursome. You cook lentils, no flavour. You got to do something. It's like tofu, it's a tasteless sponge. You got to do something. I put ginger and garlic and herbs and lemon and oil and salt, let it marinate for a couple of days. Amazing. I say, if your tofu doesn't taste nice, it's your fault for not putting enough flavour in it. Don't go lightly on the flavourings, you know. It gives a real nice punch. And so I'd like to give you a story of a lady that came to with sinus problem. It's quite an extreme story. She was 32. She was overweight. And she said, my main problems are sinus. She said, I have daily headaches. The pain is so much. So always mouth breather. Being a mouth breather, she's not getting oxygen into her cells. So you know what she's just been diagnosed with? Chronic fatigue syndrome. Can you see the diagnosis comes, but there's no assessment of why or what can be done about it? And I know in Australia with Medicare, the doctor's only allowed to spend 15 minutes with you. How much can you find out in 15 minutes? And that's why I believe each one of us should be our own doctor. We know our history. And it's important as being your own doctor is begin to document your case. Look at your childhood. Look at what happened there. And if your mother's still alive, ask about your birth. Were you vaccinated? Any drugs? Did the mother have drugs in pregnancy? Because all of this makes us who we are today. But we've got a very forgiving body. And I thank God every day that it's got an inbuilt ability to heal itself. And I think you'll agree with me, it bears long under abuse. But the day comes when it usually says, enough. And then they give that a name called disease. So this lady, when I looked at her diet, because she felt so miserable, she just grabbed the fast food, bread, cereal, pasta, 2-minute noodles. She didn't realise that she was feeding her problem. And so at Misty Mountain Health Retreat, we don't use any of these foods. And 2 days on juices, the body clean, it gets clean pretty quickly. In fact, after the break, I'm going to look at the fast that we do at Misty Mountain, and we're going to be looking at the liver, the project manager who orchestrates it. Within 3 days, she was not getting headaches anymore, and we were getting her to get a herb. This is quite a remarkable herb. It's an expensive herb. We can't get it in Australia, so every time I come to America, my staff say, please bring some golden seal back with you. And when I get into Australia, we get it as the powder. So when I get into Australia, I have to declare everything, so I write herbs. Now, did you know in Sydney Airport, you can't fly in before 6 a.m. and you can't fly out after 11 p.m. So at 6 o'clock, you've got about 10 planes from all over the world all landing. So the Aussie immigration, they're moving you through quick. And they come up and say, what do you got, herbs? What are you going to do with the herbs? Make a herb tea, I'll go through. And we do make a herb tea with some golden seal. But what if you can get the golden seal powder? Golden seal is called king of tonics to all mucous membranes, and all your respiratory is lined with mucous membranes. So it has a tonic effect. But something else very interesting about golden seal, it's a huge or a broad range antimicrobial. It's antifungal, anti-yeast, antibacterial, anti-staphylococcic. Did you hear that? There's not a drug that will kill staph, golden staph, but this herb will. So we get people to sniff it. Now, did you know when you make a fist, you've got a little dip right there, and it's called the snuff dip. And they used to put snuff in there and you'd sniff it. Well, that's what you do with the golden seal powder. Sniff it up into the sinuses. Don't go, or it'll feel like the top of your head's about to blow off. Just little sniffs. Just do a little sniff with one side and a little sniff on the other. That's a very expensive herb, but you only need the slight little amount. So that's what we got this lady to do. Twice a day she would sniff up the golden seal. She said to me after a couple of days, she said, Barbara, it's like I'm blowing green barley out of my nose. And when she told me that, because we do give green barley, I thought maybe she breathed in the green barley, but you know what she was referring to. Remember what that is? Ear, nose and throat specialist nurse said, we pull green slime out of that nose. Well, that golden seal was loosening the build-up and she's blowing it out. Don't get scared when you blow out green slime. Rejoice. Where was it before you blew it out? So this lady went home a very happy lady. She had direction. She now knew which way to go. I didn't hear anything. 2 years later, a lady came to do our program. She said, you don't remember me, do you? I said, I'm trying. She was that lady. She'd lost 10 kilos, which is 20 pounds. She looked great. She said, I've got a great story for you. She said, I have had no headaches for 2 years. See, their headaches were due to the build-up in her sinuses. She said, I don't have sinus problems anymore. Yes, I did blow out green slime for about a month. She said, I have stopped all of those foods. She said, I'm now a nose breather. She was a mouth breather because it was just so blocked up. The best way, if you're blocked up, is to blow your nose, and if your mouth tries to open, tape it up. And you will, as you breathe through your nose, you will open the nostrils. That's the good news. Remarkable story. Now, what would have happened if she hadn't come to our retreat and learnt these ways? You know what Misty Mountain's called? Misty Mountain Lifestyle. It's not Lifestyle Centre anymore. It's health and education. Because our aim, my aim, is to teach you how to be your own doctor so that you go home and you do it. And as you do it, you do this. You listen. You listen, and sometimes the body will go, yay, and sometimes the body will go, oh, can you go a little bit lighter on the sniffing of the golden seal, please? So you'll feel your way. When I was in Peru 2 weeks ago, there was a lady that gave a testimony of her renewed health. She said, I was working in New York. She said, I was busy lifestyle, busy, hardly ate anything and just grabbed bits and pieces here and there. I started to get health problems. I went to Peru and went to a natural healer. And he said, well, when you eat this food, how do you feel? She said, I don't know. She had taken no notice. And when he said that to her, she was challenged. So she started to notice, how do I feel when I eat this? How do I feel when I eat that? How do I feel when I eat this? Do you notice? Have you ever been to a doctor who won't listen to you? It's very frustrating, isn't it? Don't be that doctor. Everyone's gone quiet. Learn to listen. Learn to listen. When my daughter Jessica lived in the rainforest with her new husband for a few years, I visited her once because we were still in Melbourne. She said, Mum, did you know that every set of rapids in the creek has a different sound? What's she been doing? Listening. How many people notice the sound of the rapid compared to the sound of that rapid? It's learning to listen. I must tell you, I've never really mastered the art of listening to the sounds of different rapids. But Jess had time. She had time on her hand to do it. So golden seal powder is an excellent snuff for the sinuses to help clear them out. And you can stop all these foods, but sometimes people have got 10, 20, 30 years of build-up in there. And so that's when we need to be this, patient. And in the book, The Ministry of Healing, it's about page 57, the writer says, nature's process of healing and upbuilding is gradual, and to the impatient it seems slow. Can you identify with that? I certainly can. I'm wanting this am to be better right now. It was 2.5 inches, now it's only an inch. It's getting there. And I want to wake up in the morning and that hand to be just like that hand, but it takes time. It takes time. It takes time. You've got to give it time. And there's a verse in the Bible that tells us this. It's found in Galatians 6, verse 9. It says, let us not be weary in well-doing, for in due season you will reap if you faint not. In other words, you will get the results if you don't give up. Just keep going. It might have taken 20 years to get this, but the good news is it won't take 20 years to undo, but it could take 1 or 2. It takes time. You got to give it time. So stopping the allergens is the first step, but there are also things that you can do. And believe it or not, nose breathing. I want to show you something else about nose breathing, and this can be particularly helpful for people who have breathing problems in the chest, particularly bronchitis or asthma. And I'll give you the story of this professor. This Professor Buteyko was a mechanic in the First World War. And he was a very clever mechanic in the Russian army. He knew engines, so he knew how to fix them. Doesn't that make sense? What's the good of having a mechanic fix your car if he doesn't even know how the engine works? And when he came out of the war, he analysed. He thought, if I knew how the body works, I think I could fix the body. So he went to train as a physician, a doctor. He became a professor. And he tells the story one night, because sometimes those poor doctors, they're on 24/7 call. when they're training. So one night he looked in the mirror, or was the reflection of a door, and he was shocked at what he saw. He was overweight. His jaw was just hanging down. He looked terrible. He got a shock, stood up, closed his mouth, put his shoulders back, and that reflection was a confrontation to him. And so he started to breathe differently. He started to breathe only through his nose and not through his mouth, because the drop of the jaw shocked him. And he started to realize the importance of nose breathing. And he came across a man with an asthma attack one day, and he told the man to close his mouth. And he told the man to hold his breath. And within half an hour, the asthma attack had eased. So that's when he went to the drawing board. And that's when he discovered the wonders of carbon dioxide. Carbon dioxide, as I mentioned in an earlier talk, and we talked about it a bit yesterday, you need carbon dioxide to get oxygen. Remember the 4 docking stations on the hemoglobin? 4 molecules of carbon dioxide are necessary to pick up 4 molecules of oxygen. 2 molecules of carbon dioxide, you're only going to get 2 molecules of oxygen. And remember, in the cell, if the cell's got oxygen, we've got 18 times more energy coming out of that cell. And he discovered the nose. You see, mouth is for talking, mouth is for singing, mouth is for eating, for drinking, no, nose is only for breathing. Mouth is not for breathing. So last time I had a cold was May last year in Germany, and I decided to test and only nose breathe with my cold. Could I do it when I had a cold? Well, I had to have about 10 tissues in my pocket when on my morning walk. And I nose breathe through my whole cold. Because when you force yourself to nose breathe, it opens up. Even a deviated septum can open up. And please, I would never have an operation to open the back of my nose. When you understand that all you have to do is nose breathe, and it will naturally open it up. But what Professor Buteyko found, not only that when you nose breathe, you maintain correct carbon dioxide levels in your blood, enabling you to pick up oxygen, he discovered that carbon dioxide is a bronchodilator. So what's a bronchodilator? A bronchodilator is something that opens the bronchioles, which are those little, you've got your trachea and it splits into 2 lungs, goes down to smaller and smaller bronchioles. And what happens with asthma is they swell. So it's very hard for air to go in and out when someone is in an asthma attack. And so the drug usually of choice, well, it used to be, was Ventolin. And Ventolin is a bronchodilator. Ventolin opens the capillaries, or if it's quite serious, I'll put the person on a steroid, even a prednisone or cortisone puffer, and that gets the inflammation down, which opens the bronchioles, when really all the person has to do is hold their breath. Not forever, of course. We need air. But if you Google the Buteyko method of breathing, so Professor Buteyko he's died quite a few years ago now, but his method of breathing is so successful. And I've spoken to many asthmatics who've got off all their medication by implementing the Buteyko method of breathing. Now, hospitals used to give classes, maybe 4 times a year. You go to a class and you might go for a week where they show you the Buteyko method of breathing. Yes, usually we should breathe long, slow and deep, always through the nose, but he shows that when someone's having an asthma attack, if they hold their breath, it'd be like 5 seconds in, hold for 5. 5 seconds out, but only let little bits out because you want to hold your carbon dioxide. And when it's time to bring the air in, it's just tip, tip, just little bits. So you're raising your carbon dioxide levels in your blood, and that relaxes smooth muscle, which is what surround the bronchioles, relaxes them and opens them, and the person can start to breathe. So medically, it is acknowledged today as a very effective way of controlling someone who's in an asthma attack, someone who's in a crisis there. But what also happens with nose breathing, as it raises carbon dioxide levels, it stimulates your parasympathetic nervous system. And often when someone's in an asthma attack, they get very, very fearful because it almost feels like they're going to die because they can't get enough air. And it seems a total contradiction to ask them to hold their breath. But holding the breath raises carbon dioxide levels. And when those levels rise, it relaxes smooth muscle, which opens the bronchioles. Carbon dioxide is a bronchodilator. Another indicator that everything we need, we have already got inside of us. So when someone gets a cold, the best thing to do is to eat very, very little, if at all, rest, but also gently climb a mountain and dive in the cold creek, just briefly. I think I was 7 seconds this morning. Emma's a bit braver than me. She's used to it more. I think she was 15 seconds. But you can get your body used to it. And what it does is it releases cold shock proteins. And those cold shock proteins have a dramatic effect on your immune system. So I think I mentioned about my son Peter, who had, when I looked at genetics, who had asthma. My father had asthma, my sister had asthma. She conquered at the age of 40 by learning the Buteyko method of breathing and totally eliminating, finally, all the allergens. But my son Peter, we conquered it when he was only 2.5. I did not know about the Buteyko method of breathing, but I used foods, and whenever he got a cold, I would just give him fruit. That's it, only fruit. We'd put him in the bedroom and one of the children would read stories to him while we all ate. And then we cleaned all that up. And then the child that read the stories, he could come out and another child would read him stories while this child ate it. Because if a 2-year-old sees food, they want to eat. And if they can't eat, they cry. Then the asthma gets worse. So that's what we did. And we conquered his. He hasn't had an asthma attack since 2.5, and he's, I suppose he's about 38 now. And so the naturopath who I went to that helped me to know these things, he said to me one day, he rang me up when Peter was 5. He said, Barbara, I'm going to speak at the Asthma Foundation. He said, Peter was the worst case I've ever seen, and you conquered it. He said, you know more than me now. How did I become an expert on asthma? By treating my son and just observing, listening, and seeing what happened. And I think I did tell you the other day, we do the hot and colds alternating on his chest. That's not easy on a 18-month-old, but we had a child there with a whole pile of books. And every time we'd put the cold on, I'd get James to do backflips and keep him happy while we did. You get the whole family in there so we can keep Peter sitting to do the hot and colds. And we gave him an enema. And the enema made a big difference. Breathing distress went from 24 hours, which was a very difficult 24 hours, down to 5 hours. Now, the first 3 times he went into severe breathing distress. I just rushed him to emergency. You just fear for his life. His nostrils would flare at every breath, from the ears to the hips. Every breath, his body'd go like this. Terrifying for a mother to watch. But when I was in the hospital, they would give him Ventolin. I didn't see that it made a huge effect. In fact, what only helped Peter was for me to hold him. I'd sleep holding him. Finally, if he fell asleep, I could get something done. Because if he got upset, the asthma would get worse, and he would get upset, and then he'd get terrified, and gets this vicious cycle. So that's why I went to the naturopath. So that's how I knew so much. I just watched what works. But I found that the first time I did the enema and the hot and colds, the breathing distress went from 24 to 5 hours. Those 5 hours were still tough. Next time he got a cold, because within 24 hours of getting a cold, he would always go into breathing distress. So next time he got a cold, the breathing distress would be 3 hours. Next time he got a cold, breathing distress went to only an hour. Can you see what's happening? So I had to be very patient, because little by little he improved. And there was also a tea, and this herb was growing everywhere where I lived. It was called plantain. Another one is ribwort, and because it's got ribs in it, it's just a weed. We could probably find it growing out there, and it has a little seed pod like that. And you can get broadleaf plantain, and the broadleaf plantain just has a broader leaf, but it still has those ribs. And you probably even pull it out of your garden, you probably mow it down. But the seed pod on the broadleaf just has a longer, and they're like little dots around it. And did you know that those little dots are psyllium? You know, psyllium husks comes from the plantain. Well, I had read in my herb book that it was very good for the lungs. So whenever he got a cold, I would pour boiling water on half a pot of leaves. It'd go black. It was so strong. I'd put a bit of lemon juice and a touch of honey, and I'd get him to drink it. We'd get a fancy straw. We'd have tea parties. And I believe that little by little, this also strengthened his lungs. So when the naturopath said, tell me what you did for Peter, because Peter's the worst case I've ever seen. So I told him all the things. He rang me a day later. He said, it was very interesting. The people were very resistant at first, but when I began to tell them, he said, I just told them the story of Peter. He said they softened and they listened. And I remember the naturopath said, Peter's going to be as strong as an ox with everything you do. You should see him today. He's big. Anyway, the naturopath said, so the people were very interested, but do you know what? Everything I did, it took time. So many people, it's just much easier to give them a puffer than to get the hot and colds, to set up an enema. It all takes time. Takes time. But you know, it's well worth it. And what's the old saying? Choose your hard. And so the naturopath said, a lady came to me at the end of the meeting. She told me about her little boy who was also 5, same age as Peter. He said it was as if she was describing Peter, severe physiological asthma, which usually we are told there is no cure. He said this little boy is on cortisone, prednisone. He's on a glycerin enema every day, and he's been given 2 weeks to live. And the naturopath said, and look at Peter. I got off the phone and I sat there very quietly for a moment, and I thank God that I had discovered an alternate way to treat this serious illness, which people die from asthma attacks. because the fear of not getting air. I don't know if you've ever been underwater too long, or if you've ever been somewhere where you can't get your breath. That is what I'm told it's like when someone has an asthma attack. And the last thing they want to do is hold their breath. But this Buteyko method of breathing is proving to be very effective. So first of all, you have to look at why the respiratory is there. And it could be just a house clean. And if it's a house clean, great, just work with it. Hopefully you get a fever, because then it'll pass very, very quickly. And so in 2021, we had a double vaxxed man attend our program. And on the second day, when the exercise coordinator went to get him to wake him up, he said, "Look, I'm terribly sorry. I know I had a headache all day yesterday, but I've just given myself a COVID test and I've got COVID." So for that first 24 hours, he was in touch with everyone. So half the staff went down, half the guests went down. But we said to the guests, we're a better place to be than at a health retreat. We're creating a fever every night. And we've got a mix that we used to give them. And this mix we call the flu bomb. So whether it's COVID, whether it's flu, whatever it is, this has everything in it that will help your body to conquer very quickly. Flu bomb, it's called. So the number one ingredient is garlic, and it's up to you how much you can take. I've been having about 5 cloves a day. Maybe you can smell me from where you're sitting. And you crush it. And the next ingredient is ginger. I've been having lots of ginger teas every day. And that's about 1/4 teaspoon of finely grated. And the next ingredient is cayenne pepper, as much as you dare. I've been having about 1/2 teaspoon. Some people can only handle a sprinkle. Some people can handle 1/2 teaspoon. And the next ingredient is eucalyptus oil. And eucalyptus oil, there's definitely an amount on this one. You'd think as an Australian, I'd know how to spell eucalyptus. 1 drop, that's it. Now, if you don't have eucalyptus oil, you could use tea tree, maybe even oregano, something strong like that. But the eucalyptus and the tea tree, they're very good at clearing the airways. Next ingredient is lemon. If lemons are falling off your tree, you might have the juice of a whole lemon. If they're $1 a lemon, you might have 1/2 a lemon. I'll leave it up to you. Honey, 1 teaspoon. Believe me, you could put 4 teaspoons in and it won't make any difference to the flavour. And 1/2 cup of hot water. So this is a great mix to take when you've got any respiratory problems, and it helps to clear the airways. So instead of taking an antibiotic, this is God's antibiotic here. You could try inhaling the hydrogen peroxide, but we find that's very, very effective. In fact, take 3 a day. Some people might look at that and think, oh, my stomach's going to protest with that. Well, drink it and then have a bowl of thick soup. Or drink it and have a couple of bananas, and that'll just help to coat it. So that's called the flu bomb, the famous flu bomb. So that's all you need. So when this man gave half the guests COVID, my husband got it, and then a little bit later I got it. Do you know if you don't get it, it's because you don't need a house clean. And if you get it, it means you need a house clean. First day I had a headache. Next 2 days I had a high fever. I never took my temperature once. I just knew I was very hot. So what did I do? I slept a lot. I drank a lot of water, and I ate hardly anything, because I know that I live in a body that's got an inbuilt ability to heal itself. 4th day, if I laid down for half an hour, I could do something for 10 minutes. I was so tired. No wonder. You know, when you have a fever, it's like climbing a mountain. So 5th day, if I laid down for 10 minutes, I could do something for half an hour. So 6th day, I'm just about back to normal. 7th day, I'm back on track. Feeling good, looking great because my body's had a house clean. The CDC figures are that 99% of people that get COVID recover. So what's the problem? And the people that go down are people with pre-existing health conditions. The body will heal itself when you give it the right conditions. So I trust that you have enjoyed our lecture on the respiratory, and now you know how to treat it. We'll have a break now.